Hi, everyone. Thank you again for joining today's Fall 2022 NHSN CDA vendor webinar meeting. My name is Amy Webb, and I'm joined by many colleagues today. We're excited to share our updates with you. So we will go ahead and get started. Just a few housekeeping items for today. The meeting is being recorded and will be posted in a few weeks on our vendor webinar webpage. If you have questions, technical difficulties, you can put those in the chat. Otherwise, if you have questions about the content of the presentation, you can put those in the Q&A and the team will be responding to them throughout the call, or we'll save them for the live Q&A at the end of the session. The slides were sent out this morning, so check your inbox for those. If you have not received the slides yet, you're welcome to email us at nhsncda@cdc.gov, and we can share the copy of the slides with you. All right, we're going to go ahead and get started. So for today's call, we have a lot to cover on our agenda. So we'll start off with our future initiatives, talk a little bit about the NHSN release updates, then get into the patient safety COVID-19 hospital data updates, followed by updates for the 11.1 release in the patient safety component. Talk about some updates that have already happened for the long-term care facility component in release 11.0, the brand new medication safety component, followed by the vendor IDM and the CDA HAI vocabulary, another update on the gender variable, and AUR module updates, followed by the NHSN pre-production or NPPT test site, then miscellaneous, and lastly, the Q&A. So with that, I will turn it over to Pam.
Hi, good afternoon, everyone. I would like to give you a preview of our future initiatives for 2023. We will be introducing a new component, medication safety, with the module glycemic control. And you will see we will have hypoglycemia and hyperglycemia included. Nadine will give you a preview of the hypoglycemia piece later on in our presentation. We have the rebuy C. difficile hospital onset bacteremia. We also have respiratory pathogen surveillance. I believe all three of those will be residing in the patient safety component along with VTE 1 and 2, as well as the expanded venous thromboembolism portfolio. We have the initiative for sepsis that is planned for probably late Q4 of 2023, as well as non-ventilator associated pneumonia. So more to come at future webinars on these future initiatives. Amy, next slide, please. I would like to give you some of our release updates and just give you a background of the timing and the dates. So Amy, could you move forward, please? So NHSN, we're continuing to have one major release a year. Those changes include protocol changes as well as transition to our new CDA versions due to those protocol changes. And these are effective January 1st of each year. We also have minor releases occurring on an 8-week basis as needed. So moving into 2023, we will be on the 8-week cycle, whereas this year we were more on a 6 to 8-week cycle. These minor releases may include a new component or module. They may also include minor change requests, defect resolutions, as well as infrastructure maintenance and support. Most often, and normally we notify our users via a message alert when logging into NHSN for our releases. Amy, next slide, please. So our upcoming NHSN releases are Release 11.1, which is scheduled for December 10th. Defect fixes will be effective post-deployment. All CRs, change requests, will be effective January 1st, 2023. The next scheduled release is for February 2nd, 2023, known as 11.2. And again, our defect fixes will be effective post-deployment, and the CRs will be effective the next day, February 3rd, 2023. Amy, next slide, please. Okay, I will be transitioning to Emily for the patient safety COVID-19 hospital data.
Great, thanks so much, Pam, and hello, everyone. My name is Emily Witt. I'm a public health analyst on the NHSN protocol and training team. And today I just want to talk very briefly and kind of at a high level around some general NHSN updates related to the transition of the COVID-19 hospital data to NHSN. Next slide, please, Amy. So if you are not aware, on December 31st, the teletracking contract will expire and the reporting of COVID-19 hospital data is going to transition to NHSN. The COVID-19 hospital data reporting will take place in the patient safety component of NHSN. And as you can see here, the COVID-19 module can be accessed in NHSN patient safety component facilities, as well as groups, by selecting the COVID-19 option in the left navigation bar and then pathway data reporting. Next slide, please. A few important dates related to this transition is that as of November 2nd, the module is currently available in NHSN for testing of data submission. Please note that the use of the module prior to the transition date of December 15th noted here is for testing purposes only. And all COVID-19 hospital hospital data reporting activities in teletracking should continue as usual until this transition date. The transition date has been determined to be Thursday, December 15th. This will be the first day of reporting the COVID-19 hospital data into NHSN. Next slide, please. So just a few important notes that we wanted to highlight related to this transition. The first of these is that this reporting is separate from the other current COVID modules in NHSN, that reporting that's being done for long-term care facilities, the outpatient dialysis facilities, as well as the healthcare personnel vaccination. There will be no impact or changes to reporting for the long-term care facility dialysis or vaccination COVID-19 modules in NHSN. This transition is specific to hospital COVID-19 data and does not have any effect on those current modules. This has definitely been a frequently asked question, so we wanted to make sure to highlight that. The COVID-19 hospital reporting is also not a new reporting requirement. The information presented about the transition, both in what I'm kind of speaking through today, as well as what's on the transition website, which will be linked a little bit later in the next couple of slides, is not a directive for NHSN users to begin reporting the hospital COVID-19 data. This reporting has been taking place since 2020. There's likely an individual within the emergency preparedness departments, either at the facility or jurisdiction level, that has been responsible for this reporting. We know that some infection prevention departments have been responsible for this, but primarily it's been more in the emergency preparedness realm. And details about the reporting and the data fields can be found in the reporting guidance that's linked on this slide. And then finally, we just wanted to note that reporting processes should be able to remain the same after the transition to NHSN. Next slide, please. So in working through the transition process, we have found that reporting of the COVID-19 hospital data is going to take place kind of via two overarching scenarios. And that's going to be individual facilities reporting and then what we've been calling bulk upload scenarios. So individual facility reporting are facilities or hospitals that are reporting this data for their hospital or facility individually to HHS. So they are reporting at the facility or hospital level and are not submitting their data to a jurisdiction or a hospital association, third-party vendor to submit the data on their behalf. And this reporting scenarios, the facility level reporting will take place either using a web form in the NHSN application or via CSV upload. The other scenario is what we're referring to as bulk upload, and this is where jurisdictions, a larger reporting entity like the jurisdictions, hospital associations, healthcare systems, and so on, are submitting the data on behalf of multiple hospitals or facilities within their system or jurisdiction, and so on. And this reporting will take place via bulk upload, where reporting is being done via groups in NHSN, either using CSV upload or API. Next slide, please. And so to wrap up, all the information I presented today, as well as way more detailed slides and video recordings, FAQs, other resources are available on the transition webpage, which is linked here. And then if you have any questions related to this transition, please email us at the help desk, nhsn@cdc.gov. And if you'll use the subject line COVID-19 hospital, that's just an indication to the team that your question is related to this transition, and we can ensure it's directed to the correct person to answer that. So thank you so much. And I believe I will be turning it over to Hamna. Thanks.
Thanks, Emily. Hello, I'm Hamna Beg, business analyst, quality assurance analyst, and providing support for our support tickets on the NHSN project. Next slide, please. In the next slide, I will be covering the change request plan for the patient safety component for 11.1.0. We have 5 planned CRs for release 11.1. CR 3680, PED VAE, update to antimicrobial list within the NHSN application on the patient safety module component for all the locations starting January 2023. CR 3700, VAE calculator, update to antimicrobial list within the website on the patient safety module component for all the locations starting January 2023. CR 3702, a specific event criteria BRST3 removed as a selection for SSI BRST entry. BRST3 will no longer be available for SSI BRST. CR 3713, 2023 pathogen code updates for all the components within the application. CR 2725 will address the gender identity and sex at birth and will impact all components. Details about this CR will be discussed later by Henrietta Smith and Pamela Crayon. For the next slide, I will be passed over to my colleague Sylvia Schuler to discuss about long-term facility care. Thank you.
Thank you, Hamna. Hello, everyone. I'm Sylvia Schuler. I'm a business analyst and QA analyst for the NSHN project, and I also work to support the I-Support tickets that are reported for CDA submissions. I will be discussing the updates for the long-term care component for release 11.0. Next slide. In the last webinar, we discussed the initiative was underway for building the ability to accept CDAs for long-term care ID events for CDI and MDROs. Prior to release 11.0, long-term care lab ID events could only be entered manually in the UI. Now the long-term care events can be imported via CDA in the UI. These events cannot be sent via direct at this time, only via the UI. We had a CR 3548 for long-term care events CDA was implemented in the release 11.0 that was deployed in October of this year. The lab IDs can be imported via CDA for events with specimen collection dates, i.e. event dates greater than or equal to 2022, so only 2022 and forward. The lab ID event CDA uses R1D1 IG version. So please refer to the R1D1 implementation guide for creation of the lab ID events. The documentation for the lab ID events will be posted to the implementation toolkits and resource website under release 11.1 for January 2023. And these are expected to be posted hopefully by the end of the week. Now we'll turn it over to Nadine, who will cover the medication safety component. Thank you.
Nadine, if you're speaking, you're on mute. Maybe you've double muted yourself. Oh, try again, Nadine. Jonathan or Emily, do you have any tips for
You said
Nadine?
for Nadine, right?
Yes.
She doesn't seem to be on mute. I can mute her and see if she can unmute herself. Let's see if that works for her. And then that way, Nadine, if you can hear me, try to unmute yourself. She said her screen froze.
Okay. It looks like we'll do the next section and then we'll come back to Nadine while she gets. Alrighty, let's skip ahead. Back to Hamna for the vendor IDM updates.
Okay. Thanks, Sylvia. In the next slides, I will be covering vendor IDM updates. Next slide, please. The vendor IDM for release 11.1 will be posted to the toolkit's webpage as version 1. Remove a specific event criteria BRST 3 CR 3702 for SSI BRST release 11.1. Next slide, please. Pathogens are no longer reported in two different tabs. Previously, there was one tab that included preferred pathogen and synonyms. But going forward in 2023, there will be two tabs. That is, pathogen codes 2023 preferred, pathogen codes 2023 synonyms. For the next slide, I will pass over to my colleague, Pamela Crayon, to discuss about CDA HAI vocabulary. Thank you.
Thank you, Hamna. So I forgot to mention that I am the business and analyst manager for the BA team, and I also help support tickets that come in for the CDA team. So next slide, please. So as we mentioned before, we have the pathogen code updates for the January 2023 11.1 release. So this information is included. So just a reminder that we have the value set specified in the CDA implementation guides that have been distributed in the spreadsheet, the HAI_VOC. And all of this are now available in the VSAC, the Value Set Authority Center, on this website, on the NIH.gov website. And also the implementation guides will be uploaded, as Sylvia has already mentioned, on our NHSN website by the end of the week. Next slide, please. I am now passing on to Henrietta for our gender variable update.
Thanks, Pam. Next slide, please. This is I'll just provide a little bit more of an update, a follow-up from a few months or so ago when we talked about adding the new variable fields. These two new variables will be added: sex at birth, which is a synonym for birth sex in the CDA-IG, and gender identity. Next slide, please. Currently, sex at birth, gender sex at birth, birth sex, is the gender that is assigned at birth. This is intended to capture administrative sex. The options for the current selection is listed here: male, female, other. And these are the same options in terms of male, female will be with the new variable with the addition of unknown instead of other. Next slide, please. This is just a quick look at the birth sex, VSAC value sets, and these were provided by one of our colleagues at the Lantana Consulting Group. Next slide, please. Gender identity captures the gender that the patient reports, and this will be a new variable that will be associated with the event. And these are the selections: male, female, male to female transgender, male to female transgender, identity as non-conforming, other, and asked but unknown. Next slide, please. This is just a snippet of the VSAC variable set. Next slide, please. This is a continuation of that value set. Next slide, please. This is the last slide that shows the gender identity, and there will be two null flavors asked as unknown and other. Next slide, please. The timeline for implementation of these two new variables is shown here. There will be optional reporting starting January 1st of 2023 for manual entry and for CSV import. During this optional reporting period, the current legacy gender field will also be available and it will remain required. Reporting for the new variables will start as required January 2024, and the CDA import will also be available at that time. Also, January 1st of 2024, the current gender field will be inactivated. Next slide. If there are any questions, feel free to reach out to me or somebody on the PAT team related to the gender fields. Next up is Melissa.
Thanks, Henrietta. We're going to go back to Nadine. Nadine,
Okay.
Can we hear you now?
Yes, can you hear me?
Perfect. Yes, go for it.
Right, sorry. Okay, sorry about that. Good afternoon. I'm Nadine Chiap, pharmacist consultant to NHSN. Next slide. So with the December release, NHSN will make available the first version of a new NHSN component, medication safety. The first module within this component will address medication-related hypoglycemia or low blood sugar related to diabetes medications. Next slide. The goal of the NHSN glycemic control hypoglycemia module is to establish an EHR neutral standard for submitting inpatient medication-related hypoglycemia data electronically to NHSN, with the objectives of supporting U.S. hospitals and measuring medication-related hypoglycemia to improve glycemic management and facilitating benchmarking of medication-related hypoglycemia rates for U.S. hospitals. Next slide. Hypoglycemia remains one of the most common causes of medication-related harm in U.S. hospitals. This HHS Office of Inspector General report that was released in May of this year identified medication-related hypoglycemia as one of the top 3 causes of harm in a nationally representative population of hospitalized Medicare beneficiaries, findings similar to a report released 10 years ago. Next slide. Facilities that will be eligible to report to this module will include all inpatient facilities once they've enrolled in the NHSN medication safety component. Long-term facilities, long-term care facilities, and outpatient dialysis facilities would not yet be eligible. Please note that the glycemic control module or the glycemic control component, including the hypoglycemia module, will be the first of several modules that will begin using the FHIR standard for data transmission to NHSN. So facilities must work with their EHR vendors to enable data transmission via the NHSN FHIR endpoint. Next slide. In terms of the planned FHIR resources and FHIR data elements to be collected, they will be collected for inpatients receiving diabetes medications. The facility's FHIR endpoint would expose only selected pre-specified FHIR resources, which are listed here, and that are invoked upon permission from the facility's server. And the data access from the facility can be controlled on a FHIR resource by resource basis. Next slide. In terms of timeline, with the December release, we expect the NHSN Glycemic Control Hypoglycemia Protocol to be published. And for selected U.S. hospitals who are currently participating as pilot or innovator sites, they will be able to activate the NHSN medication safety component. They'll be able to complete the annual survey as well as the monthly reporting plan. It'd be enabling of NHSN user and group rights for this component. And we'd expect NHSN FHIR endpoint integration with that facility's FHIR endpoint. Again, in the December release, this will only be for selected U.S. hospitals who are participating as part of a collaborative and as pilot or innovator sites. Next slide. This table summarizes the metrics NHSN will produce based on the data submitted to NHSN. The primary measure planned is one that's aligned with a newly introduced ECQM, Electronic Clinical Quality Measure, for the CMS Hospital Quality Reporting Program called Hospital Harm Severe Hypoglycemia, otherwise known as NQF 3503. And the remaining measures were identified to inform and support local quality improvement and national benchmarking. It's important to emphasize here that it's not expected that the vendors will calculate these metrics. The metrics will be calculated by the NHSN application upon receipt of the FHIR line level data and provided back to the facility in summary and line level form. Next slide. We anticipate the glycemic control module to be released in phases, with initial phases providing the primary and complementary measures, and later phases providing the ability to stratify, benchmark, and also include, as mentioned at the beginning of this talk, hyperglycemia metrics. Next slide. In terms of the timeline for the module release, in quarter four of this year, again, a beta version of the module will be launched for selected early adopter and pilot sites. We'll be reviewing and revising as per the beta testing results. In the first and second quarters of 2023, we anticipate that hypoglycemia could be open to all hospital sites with a FHIR R4 API. And the second quarter of next year, we anticipate hyperglycemia module will open up as another event that could be reported in the glycemic control module as a whole. Next slide. NHSN is working closely with healthcare entities, providers, and EHR vendor partners to pilot measure development, application testing, and measure reporting, and better integrate user perspectives into these new approaches to public health surveillance and new ways of healthcare data acquisition. If you're interested in learning more about how to become a pilot site or make this module available to your hospital partners, please contact NHSN. And this concludes the update for the medication safety component. Thank you, Amy.
Thank you, Nadine. Okay, so now we're going to AUR module updates. Virgie, take it away.
Thanks, Amy. Hi, everyone. I'm Virgie Fields, one of the public health analysts on the NHSN AUR team. I will briefly talk about previous AUR updates made to the NHSN application. Next slide, please. Previously, an issue was identified that caused staff ORIS AR events uploaded into NHSN from December 1st, 2021 to September 9th, 2022, with reported values of unknown for the two lab test variables, PBP2A agglutination and PCR-MEC gene, to be saved to the NHSN database as positive. NHSN resolved this issue with a 10.15 release on September 9th and reported values of unknown correctly saved as unknown in the NHSN database for these two test variables. An email was sent to affected facilities on September 15th, notifying them of the issue and fix. If a facility plans to use the PBP2A agglutination and PCR MEC gene test variables for internal analyses, they'll need to re-export staff ORIS AR event files from their vendor system and then re-upload them to NHSN to replace the original record. Next slide, please. Previously, an issue was identified that caused the Report No Events box on the Missing Events tab of the alert screen within NHSN for outpatient locations, specifically locations mapped as emergency department, pediatric ED, and 24-hour observation, to be automatically checked if no AR events were reported for these locations when the user clicked the box to report no events for the facility-wide inpatient or FAC-wide-in record. In other words, the issue caused users who were reporting no events for FAC-wide-in only to also report no events unknowingly for all outpatient locations if they had not uploaded any AR events for those locations. NHSN also resolved this issue with a 10.15 release on September 9th. An email was sent to affected facilities on September 13th, notifying them of the issue and fix. Facilities may notice new missing events alerts for outpatient locations on their alert screen within NHSN. Facilities should review the missing event alerts and either upload the missing AR events for those locations and months or click the Report No Events box to report a true zero for those locations and months. Next slide. I'll now pass it on to my colleague, Amy, to talk about updates for the upcoming December release.
Thanks, Virgie. So I'm going to talk about the AUR module updates for the next release. First up, CR 3219 will be updating the AR option specimen source list. So we've reviewed our specimen source list and updated it with one of the most recent versions of SNOMED. We added quite a few codes, around 60, mostly to the lower respiratory tract specimen type. We removed 20-ish from mostly urine and blood, and then changed the display names for just a handful of them. So that new list will be in the specimen source tab of the IDM. So just like you use currently, those changes for specimen sources will be effective January 1, 2023, moving forward. So you'll use the current or old list for specimens collected in 2022 and prior. For the AR option side of the pathogen updates, technically we are not changing any of the pathogen codes that are accepted by the AR option. That's in the pathogen codes 2023 preferred tab in the IDM. So you'll notice no changes for AR in that tab. However, we are updating our pathogen roll-up workbook. We've removed some inactive codes and added a bunch of additional codes to the roll-up workbook. So that will also be in the updated IDM version. CR 3626 updates the AU option a little bit. So we are not adding or removing any drugs for calendar year 2023. However, we are updating the logic that's behind the CDA submission for AU so that all 95 drugs that are included in the antimicrobial ingredients tab of the IDM must be included in the CDA file. Right now, the application is looking for the 3 required COVID drugs and then a range of drugs. Starting with the January 2023 AU files, the application will look for all 95 drugs to be included in the file. If any of the drugs are missing, the file will fail to upload. We have a few items that are delayed until 2023 that Melissa will cover in the next section. Turn it over to you, Melissa.
Thank you, Amy. I'm Melissa Mojica, one of the subject matter experts of the AUR team, and I'll be reviewing some items scheduled for 2023. Next slide, please. The change request 3550 doesn't have a direct CDA impact, but we want to let you know we'll be updating the language throughout the NHSN application from the Meaningful Use Program to the Promoting Interoperability Program. We've already made this change on our public-facing web page as shown in the screenshot on this slide. Next slide, please. CR 3604 is related to CDA in that we will be updating the message displayed during the manual CDA upload process. Currently, the same message appears, see the screenshot here on the slide, regardless of how many files within the zip actually successfully uploaded into NHSN. As you can imagine, most people see the green check mark and assume all is good to go, when in many cases, one or more files could have failed to upload into NHSN. Our plan is to update the pop-up to make the upload results more clear, prompting users to click the Show Report button and ultimately help users have a better understanding of the CDA data upload process. Next slide, please. CR 3714 update the display name for the code IMI PWC from imipenem with cilastatin to just imipenem. This does not affect what is accepted by NHSN. This change reflects the true susceptibility test completed by labs and aligns with the LOINC description since cilastatin is not an antimicrobial. It just enhances the imipenem when administered together in certain situations. Cilastatin is also not included in susceptibility testing for imipenem. Next slide, please. Defect 10328 allows facilities to report AU option data from locations not eligible for AUR reporting. The locations include the endoscopy suite and sleep study unit. Please note that the AUR eligible locations are indicated with a Y in the AUR column in the location codes tab of the IDM. This is scheduled for the 11.2 release. Next up is my colleague, Amy. Thank you.
Thanks, Melissa. Okay, so many of you have been working hard on the AR option synthetic dataset validation, and we wanted to share today that the requirement will officially be postponed until May of 2023. So previously we had stated that the validation was to be completed prior to January 1st of 2023. We are extending that deadline to be May 1st, 2023, which means that the AR summary records for May 2023 and forward would need to include the vendor ID and SDS validation ID. And similarly, AR event records with specimen collection dates May 1st, 2023 and forward must include those two variables as well. So we know many of you are working hard on completing that validation. We are in the process of getting a new package posted. We hope to have that posted early next week. This will be right now. You can see release 1.1 on the website. We will be updating to release 1.2. The changes we'll be making, we updated the ADT tables to include a null cell for the ward ID in the discharge rows. We've updated a few susceptibility results on the data tables as well. And then also updated the validation web service to accept CSV files instead of Excel, since we were running into some data format issues with Excel. As I mentioned, we expect that to be posted soon, hopefully next week. We will send out an email to everyone when that is posted, however. Okay, and next, some miscellaneous updates to share. So if you haven't heard, in August of this year, CMS issued their final rule that contains some updates for the Promoting Interoperability Program. In that final rule, they stated that beginning in calendar year 2024, facilities participating in the Promoting Interoperability Program would be required to submit data into the AUR module, which includes both the AU and AR option data. I have the link to the full rule on the bottom of the slide if you're curious to know the official language. We do have our guidance document for facilities participating in the PI program. Essentially, it is relatively straightforward to complete the steps to get the credit for submitting data. But if you notice more of your facilities asking for the promoting interoperability, aka a meaningful use test files, that is one of the steps for facilities to complete the testing and validation phase to get credit for the PI program. So if you have questions, you're welcome to email us at the CDA help desk. As Sylvia and Hamna mentioned, we're in the process of updating our toolkits. The AU and AR toolkits are a little bit behind schedule, so they'll be posted after the rest of them. As mentioned before, the toolkits will contain the updated 11.1 IDM, which will have the new specimen source tab. The AR toolkit will contain the 2023 AR pathogen roll-up workbook, and we've updated the helpful hints for both AU and AR toolkits, and I included the link on this slide. The 2023 AUR module protocol will be posted next month. The plan is to post the AUR protocol as well as all the other protocols in early December. For AUR, we don't have any major changes, but we did make quite a few clarifications based on questions we've gotten from the AR SDS process. We added sections for the AU TAS and the new AR analysis reports that will be coming out in the next few releases. And again, we'll send out an email to you all when the updated protocol and toolkit are posted. Lastly, just a quick update on some data quality outreach that will be occurring soon. While we were getting the 2021 AU option data report together, we noticed that there were some antimicrobial days reported for certain drugs via routes for which they are not commercially available. So that could be off-label use or a potential mapping error between the facility systems and the vendor system. So we do plan to reach out to facilities with data in that group for incompatible routes, as we're calling them, for both 2021 and 2022 AU data to ask them to review the data and re-upload if need be. So for you all, we ask that you monitor your requests from facilities to see if there are any incorrect mappings and assist your facilities with those corrections. That's all for the AUR updates. So now I'll turn it back over to Hamna.
Thanks, Amy. In the next slides, I will be providing information about the NHSN pre-production test site, NPPT. Next slide, please. NHSN pre-production test site, or NPPT, is available for all the vendors. NPPT allows vendor to test their code in prior to NHSN deployment. To request a test site, please follow the instruction on the slide and send complete forms to the CDA team. Next slide, please. When logging into NPPT, please read important message at login. NPPT is currently on version 11.0.0.4. Blast email will be sent out when NPPT is upgraded to a new version. Version 11.1 will be available by mid-November. Any issue found in testing, please send an email to nhsncda@cdc.gov. I will now pass over to my colleague Sylvia Schuler to discuss miscellaneous. Thank you.
Thank you again, Hamna. On these slides, I will cover some additional information that will provide guidance, statistics, and resources for CDA implementation and processing. Next slide. This slide has the CDA import data comparison stats. This slide displays the percentage of CDA imports versus manual entry or CSV import for procedures. Next slide. We're going to provide a quick update for CDA direct automation. Traffic has continued to increase significantly. We now have approximately 77 direct addresses and over 9,500 facilities sending bills CDA direct. For those of you who are not using Direct yet, it is a batch submission process with no immediate reply. We typically request you to allow 24 hours for processing. However, the turnaround time is based on the volume of messages in the queue. If you're new to Direct or want to learn more about Direct, there's a Direct toolkit on our NSHN website. However, before you start your process, we do recommend you schedule a call with us. We'll be happy to discuss the Direct process and recommend best practices. A developer and Direct administrator will join the call for a technical discussion. Next slide. CDA support is available on NSHN website. The first link is the main CDA submission support portal. Other important links provided on this slide are to the CDA toolkits and guides to CDA version. Screenshot here will be updated to include version 2023 for 11.1. And the column you see here for 2019 for 2.9.2 and 9.3 will be removed. And just as a reminder, the NSHN supports CDA versions that are valid for the past 2 years. And again, I want to emphasize we were a little late with the posting of the new documentations for the CDA implementation guides, the CDA, the vendor IDM, as well as the impact notes. But as we mentioned earlier, we're pushing hard to get those posted by the end of this week. Next slide. Implementers can also use the HO7 GitHub website for the latest IG guides and get access to the XML related files, the schematrons, the CDA schema, samples, and the style sheets. This information can be found at the link provided in this slide. Next slide. A few more helpful resources may be found using the following links. The first one is the NSHN newsletter. Next is the release notes and communication updates. And last is the link to the webinar and training videos, which is where the video of this webinar will also be posted. Next slide. As always, we welcome any feedback. If you're not on the CDA distribution email, please let us know. The CDA team is also offering one-on-one quarterly meetings with vendors. Send an email to the CDA inbox if you have not had a chance to schedule a call with us or you would like to. Please include any topics of discussion so the proper team will be on the call. Thanks, everyone. This concludes the slides. Now we'll turn it over to Amy for questions, answers.
Thanks, Sylvia. All right, so thank you everyone for joining today. You're welcome to add your questions to the Q&A box now and we'll go through them. Let's see, there was one for me that I'll answer. The ARSDS is no longer required for January 2023, but now for May 2023, correct? And that is yes. The requirement was postponed from January to May of 2023. Pam, we have two questions about the gender variable, but Henrietta had to drop off. So I'm not sure if you're able to answer these or if we should get them to Henrietta and she can follow up with Jamie and Connie.
So Amy, the one about the fire gender identity extension. So I think that's a request that we need guidance from NHSN on how participants need to handle cases of multiple active values for the patient in regards to the specs. So more to come on that if it's not already in the vendor IDM. So we'll follow up on that. And then the second question was gender at event level. That we will need to have Henrietta to answer that question.
Okay, so
And so we can reach out to those individuals for the answers.
okay, so Connie and Jamie, you'll be hearing from us once we get connected with Henrietta. Thank you. All right, next question from Jeremy. Are you planning on making available the direct send capabilities for the COVID-19 reporting? We just spoke about this one this morning. I don't know, Pam, if you want to take this one or if we should defer it to Emily.
I was going to defer to Emily, but we are planning on doing direct for COVID-19 reporting. It is tentatively planned for, I want to say the end of the year. But don't quote me on that, but we are planning on making that change.
Okay. Next question from David. Please clarify when documents will be available from the website. So I was hearing maybe later this week for IDMs and not until December for the protocols. Is that correct? Yes. So there are 3 different items that we're referring to. So there is what Sylvia was referring to as the 11.1 release package, if you will. That includes the vendor IDM for 11.1 as well as the links for the impact notes. And what's the last item in that, Sylvia?
The CDA implementation guides.
And the implementation guides, thank you. So that will be going live hopefully at the end of this week. Then there's also AR and AU toolkits that are a little bit behind, but for the IDM for like the specimen source update, you can refer to the 11.1 info that will be posted later this week. That's the same that will be in the AUR toolkits, except the AUR toolkits won't be ready by Friday, hopefully next week. Those toolkits will contain the exact same IDM, but also the 2023 AR option roll-up workbook, as well as updated helpful hints for our vendors. And then the last item is the protocols. So those are the large chapters in text, basically, for the users. Those will be posted in December. So we plan to have that posted with all of the other protocols. So like the update to the BSI and the UTI and all those other protocols for 2023, they'll all be posted together at the same time. Okay. Next question from Connie. Is the VAD site updated yet with the new info for 2023 that will be in the IDM for 11.1? By VADs, do you mean VSAC, Connie? Yes, okay. Pam, do you know if VSAC is updated with 2023?
I do not know.
Okay, so we'll check with Sheila Abner on that one and get back to you, Connie. Okay. Next question from Edward. Does the change to the gender value set affect AUR CDA submissions? That answer is yes, it will. So with January 1, 2023, that starts the optional change on the UI only. And since AR, there is no UI for AR events, technically the change doesn't apply to AR until the CDAs are ready, which will be next calendar year, 2024. So when the CDAs are updated with those new variables, it will affect AR event as well. But again, not until January 1 of 2024. AU, because it's not patient level, will not be affected at all by the gender value set update. Okay, and our next question from Ricardo regarding ARSDS. Is there more documentation for validation pages for numerator and denominator? Right now, I'd recommend reviewing the ARSDS package, which is posted online on the SDS page, the same page that has the AU SDS stuff. In that package, you can find the instructions document that has all of the information that you'll need for interpreting the data tables, as well as how to structure the files and understand the error messages that the web service produces, if any. For those that are working on ARSDS, if you have specific questions, feel free to email those to us, or we also have Thursday afternoon time slots set aside. If you wanted to ask questions of our developers, just send us an email and we can set aside one of those time slots for your team. Okay. Let's see. Okay, next question from Connie. Although not required and postponed until May, can we proceed to get our SDS validation earlier? Yes, you can. And hopefully you will. Once we post the next version, the 1.2 version, you'll be able to start working with that immediately and proceed through the validation process. Okay. So our Q&A queue is cleared. Let's give it another minute or two to see if anyone has any other questions. If you think of something after we sign off, as always, please direct those to the NHSN CDA at cdc.gov mailbox. We can answer them from there. Okay, so I don't see any other questions. So on behalf of my colleagues, thank you all for joining us today. We look forward to getting these documents posted for you, and we'll send out an email when they are live for you. But otherwise, have a great rest of your day, and we'll speak with you next time. Thank you.